Hi, I'm Amber. I'm a nurse who works in our Prepare Center and with our case managers at our Bone and Joint Institute. I'm going to go over some of our pre-surgical prepare options for you for surgery. A lot of information. Please feel free to ask questions if you need to. The key to success for your surgery is to prepare. We want to make sure you're prepared for your pre-surgical experience, your surgical experience while you're here, and then for your transition home. How to best prepare for your surgery? Well, everybody here is having surgery because you have a hip or a knee that needs to be replaced. Most of you, if you had an option not to have surgery, would choose that, but unfortunately, all of our other options have been tried, and now is the time for that replacement. In order for that to be a successful replacement and for you to have the best outcome after surgery, we need to make sure you're prepared ahead of time, and I'm going to go over those things. Our Prepare Surgery Center is located at 31 Seymour Street, Suite 204. Your Prepare appointment will go over a lot of things to help us prepare you for surgery, both medically and make sure your home is safe. Prepare stands for Procedure-Related Education and Anesthesia Risk Assessment. It's unique to our Bone and Joint Center, and we do find that patients have a great experience when they go through the Prepare Center. At the Prepare Center, you'll have a medical risk assessment and testing. You'll meet with a nurse practitioner from anesthesia, goes over a lot of different things with you, including a history and physical, lab work, EKG, your medications, and some preoperative education. We want to make sure that any high risks for anesthesia are looked at and make sure that everything is in order for your surgery. Prior to your appointment at the Prepare Center, you'll receive a phone call from a nurse. The nurse is going to go over your medication and medical history. It's important that we have this information prior to your Prepare appointment so we can make sure that any necessary information from, say, your cardiologist or your pulmonologist or your primary care center is obtained. If you do have a specialist, such as a pulmonologist or cardiologist, we do ask that you have an appointment with them to make sure that you do have the clearance for that. Please attend your appointments and please answer phone calls. The nurse from Prepare is going to go over the home safety checklist with you. They're going to make sure that you have the durable medical equipment you need, and we'll go over that later in the class. You want to make sure you complete all your forms and documentations. If the surgeon's office has asked you to fill out any insurance forms, that those are completed. And you want to make sure that all of your information is accurate as well. Everyone always wants to know, when will I know what time my surgery is? You do know the date of your surgery, however, you won't know till the day before your surgery about what time the surgery is going to be. You'll receive a phone call between 1 and 6 p.m. on the day before your surgery. So if you're having surgery on a Wednesday, you'll receive a call on a Tuesday. If you're having surgery on a Monday, you'll receive it a business day before on a Friday. Bringing your medication list to Prepare. It's important that we have an accurate list of your medications because we want to make sure that all of anything that might interact with the anesthesia or interact with the surgery is accounted for. Your nurse is going to go over these medications on the phone with you, but we also ask that you bring a list of these medications to your Prepare appointment. We want you to include any over-the-counter medications, even if you only take them once in a while, any vitamins or supplements or herbal remedies. Please bring these with you and report them accurately. If you are taking non-steroidal anti-inflammatories or NSAIDs, ibuprofen, naproxen, Aleve, Motrin, anything like that, we ask that you stop those a week prior to surgery. The nurse practitioner that you meet with in the Prepare office will review all of your medications with you, and they will give instructions to you when you need to stop specific medications, what medications you may need to take the night before surgery, and what they would like you to take the morning of surgery. So you will get written instructions regarding that from your Prepare appointment. If you are on a blood thinner or anticoagulant, such as Coumadin or warfarin, Eliquis, Pradaxa, please let your physician who is prescribing that medication know that you are having surgery so that they can be aware and give instructions regarding that blood thinning medication, whether it's okay to stop or if we have to transition you to a medication that's safe for surgery. How can you prepare for surgery, other than coming to your prepare appointment, so that you have the best outcomes? We want to make sure of a few things. One of the biggest things is if you are a current smoker, it's important that you stop smoking prior to your surgery. Ideally, we'd like you to stop smoking 2 weeks prior. And it's not just because, I'm sure you've heard from most healthcare professionals that smoking is bad for you, but smoking and itself does inhibit the healing process of the bone and the prosthetic that's been implanted. So smoking can negatively impact your ability to heal after surgery, and it's very important that you do your best to stop that prior to surgery. Also, no alcohol at least a week prior to surgery. We do recognize that some people have a glass of wine at dinner every night. That's okay. We'd like you to stop that a week prior to surgery to make sure we don't have any interactions with the anesthesia or there's no withdrawal symptoms even from a small amount such as that. If you have any dental work that needs to be done, we ask that you do that at least 2 weeks prior to your surgery. It is important, even if it's just a cleaning, we'd like that done before your surgery and at least 2 weeks to avoid any chances of infection. Please speak with your surgeon if you have any major dental work that needs to be done and you need to adjust your surgery to accommodate for that. Nutrition. Having good nutrition prior to surgery is going to be incredibly important for your recovery after surgery. You want to make sure you have a balanced diet. If you've been recommended to work on losing weight, that you're following a diet plan recommended by your physician or a nutritionist. Protein is very important for wound healing and for your body's ability to heal. So making sure you have adequate protein in your diet along with fresh vegetables and other healthy options is quite important. Exercise. Everyone, if you have a knee or hip problem, exercise can be very, very difficult, and we understand that, and you're hoping that after the surgery, you'll be able to move better. One of the things that you can do prior to surgery is work on your upper body exercises. Using a walker or crutches after surgery requires a lot of upper body strength. So having a workout, whether it's just some upper body arm exercises or you're doing some pushes up off the chairs, is very important to increase your upper body strength prior to surgery so that you're able to work with that walker and crutches and be less sore after surgery. Before surgery, usually 2 to 3 days before surgery, you're going to use what we call a Hibiclens shower or chlorhexidine gluconate. This is a very specific antibacterial soap. You can get it at CVS, Walmart. If you can't find it, please ask a pharmacist and they can show you where it is. You're going to use this in a shower at least 2 times prior to surgery, and I'll go over that a little bit. We want to make sure that you use this because this is what is going to help prevent surgical site infections. You're going to use it the night before surgery. You're going to put clean sheets on your bed, get a clean towel, clean washcloth, and you're going to get clean pajamas. You're going to take all of your jewelry off. Jewelry stays off from this point on. If you have a piece of jewelry that cannot come off, please let your surgeon know when you get to the hospital the morning of your surgery. Otherwise, please take all jewelry off and leave it off from this point on. You're going to take a regular shower with your normal soap, normal shampoo, everything you normally do. You're going to rinse off. You're going to take that clean washcloth, you're going to put some of the Hibiclens on that washcloth, and you're going to scrub from your neck down, focusing on the area, whether it's your hip or knee, that's going to have your surgery. You do want to avoid your face, head, and genital areas as it can be irritating. And it's not going to get very sudsy, but you want to make sure you get all areas as possible. You're going to rinse off. You're going to dry off with a clean towel, put on clean pajamas, sleep on clean sheets the night before surgery, no pets on the bed, please. And then in the morning, you're going to wake up and you're going to take a second shower with a clean towel, clean washcloth, clean clothes. You're going to only use the Hibiclens the morning of your surgery, not your regular soap. So just the Hibiclens, rinse off, get dressed in comfortable clothes to come in for surgery. Again, no lotions, deodorants, powders, unless something is a prescription that you do need to use daily. After these showers, that would be putting bacteria back on your skin. The night before surgery, unless otherwise directed by the Prepare Center or your doctor, we do want you to stop any food, water, coffee, tea, ice chips, anything from midnight the night before your surgery. The reason that we do this is to help prevent pneumonia after surgery. We want to make sure that there's nothing in your stomach that can come up during the anesthesia and go into your lungs. If you are directed to take any medications in the morning, we want to make sure that you take those with a small sip of water. That is okay. Just a little bit of water, at least amount as possible. And then any questions on that, or if you've been getting specific directions by the anesthesia or prepare center, you can follow those directions as well. What to bring the day of surgery. We do want you to bring 2 forms of identification and your insurance card. We want you to bring your hearing aids, dentures, glasses, and we would like them in their cases so that when they're with your things or with a family member, they don't get lost or damaged. If you have a CPAP or BiPAP machine, if you have sleep apnea, it's okay to bring your own. You don't have to. We do have ones here. But if you're more comfortable with your own mask and machine, you may bring that with you to the hospital. Also, clothing. You do want to bring comfortable clothing the day after surgery. We do want you up and getting dressed. It's important to have a loose clothing, things that are comfortable. For pants or shorts are usually most comfortable for patients after surgery. You want to make sure that they're nice and loose, gym shorts, pajama pants, things that are not going to be tight around your leg. Okay, no yoga pants, spandex, anything like that. You want to make sure that you have good shoes. Sneakers are preferred. They do need to have a back. We want to make sure that your feet are not sliding out of the shoe. No Crocs, flip-flops, sandals, or anything of that nature. We don't recommend skirts or dresses for women, just because we want to make sure that if you're in a physical therapy session in our gym, if you're laying down, that everything is covered. So pants or shorts are preferred. Things we don't want you to bring day of surgery. You should not need any jewelry. We ask that you please leave all valuables at home. You shouldn't need any credit cards or anything like that. Any watches, anything that is small or might go missing, we do ask that you leave home or leave with a loved one. All of our rooms are private rooms. I do want to say that. And we do have a cabinet in each room that locks, and you can lock your purse or things up in that after your surgery in your private room. However, we do want to make sure that you keep anything of value at home.